a public option. So I guess my question then is, if the government's going to be getting involved, we would have to ask ourselves, we've heard a similar question before, but were we better off before or after the government got involved? I think before. Have any of you heard Senator Casey talk, or any of them in their town hall meetings that they went to? Casey actually came up to Erie. He did one a couple of weeks ago. Yeah, it was pretty much announced that morning. Some people knew a month ahead of time. I went to the meeting, and one of the things that he said, and his quote basically was that if we don't do health care reform now, annual premiums for a family in Pennsylvania in the year 2016 will be $26,679. So he said we must do health care now to avoid that. My concern is once we give up the control to the government, we're not going to get it back. And I want to show you the results of health care reform in some other states as to what you will see happening in Pennsylvania. So I want to start by looking with New Jersey. It's our neighboring state. New Jersey's actually had health care reform since 1992. So 17 years, they should be pretty good at it now, wouldn't you think? I mean, generally 17 years is a lot of practice. When I look at New Jersey, here's what they ended up with. They have plans that give guaranteed access to health coverage for individuals and small groups. The plans were issued regardless of age status, health status, claims history, or any other risk factor. So that's basically what the government's talking about. They want people to get insurance regardless of any issues that they have, and at a common price for everybody. So what they have is 5 standard plans. Whoever the carriers are in New Jersey must offer these plans. When they started this, it was 22 insurance companies offering. And remember, the government says this will create competition. Now in New Jersey, there's only 4 offering PPO health plans. There was 22. They have community ratings, so everybody, again, gets the same rate. They have portability. They can take the plans with them. Pre-existing conditions are covered. And they have an 80% minimum loss ratio that says 80 cents of every dollar spent in premiums must be spent in claims, or they have to lower premiums, do a rebate, or something along those lines. So I said, this is very similar to what we're hearing Washington say that we need, and it's very similar to what Governor Rendell has proposed for his health plans that have not been passed yet. Again, what are the results? Casey was concerned about premiums getting to almost $27,000 in the year 2016. Here's current rates in New Jersey for individuals trying to buy insurance for a family. If this family had a $2,000 deductible and another $6,000 in out-of-pocket max per year, so $8,000 exposure. $8,000 is a lot. The cheapest premium for that family, if you're under 25 years of age, is with Oxford Health, and it's almost $18,000 a year. Now, Oxford just switched to those rates because they're the only carrier there now that rates based on age. They were given approval for that. If you are 65 or over, your family coverage is almost $33,000 a year. The most expensive carrier is Celtic, and you can go right online to the New Jersey Department of Insurance and see these rates right there. I just pulled them off last week. Celtic's rates for a family now are $168,744 a year. $168,000 a year. These rates have been approved by the New Jersey Department of Insurance. They're justified based on loss ratios, but I'm sorry, I don't consider them to be affordable. And if we're going to do health care reform, it has to be affordable, or it's not going to work. So now, New Jersey, some people say, oh, that's individual. Their group rates have to be better. No, they're not. Their group rates aren't a whole lot better. For a $500 deductible and another $5,000 out of pocket, an individual, the cheapest rate for an individual is almost $500 a month. The most expensive carrier for them is $668 a month. For families, it goes up to $2,000 a month. Okay? I've been in this business 25 years. Our office works with hundreds of employers. We have very few accounts that are even close to that. All right? Let's look at some other states. Hawaii. We've heard our president lived in Hawaii for a while. Hawaii last year introduced the only universal health coverage for children in the United States. They were the only state to do it. This was an article, October 17th, the Associated Press reported that Hawaii was dropping the only state universal child health care program in the country just 7 months after it launched, due primarily to budget shortfalls. Guess what? It cost a lot more than they thought it was going to, and that's going to happen with our government programs as well. They found that families were dropping private coverage to go into programs that were subsidized, and our government's been telling us people won't drop their private coverage. Yes, they will. Hawaii's proof. September 5th, 2008, the Washington Post had an article regarding Rhode Island. And they said they were seeking limits on Medicaid spending as a result of serious budget shortfalls. Every one of them seemed to have that as a common theme, serious budget shortfalls. And critics said it would limit access to nursing homes, charge poor families more for medical care, and potentially establish waiting lists or cut people from the program. Now, could we consider that a form of rationing? We've been told there's not going to be any rationing. But if you're creating the waiting list or cutting people from the program, I think that's a form of rationing. And I think it's something that we have to be concerned with. The Commonwealth Fund, people said, okay, but Massachusetts, they've got majority of their people covered now. That's been a success. Yeah, they had most of the people covered, but 2 weeks ago it was announced that Massachusetts is now the most expensive state in the United States to buy health insurance for families. So again, they underestimated what the costs were, and premiums have had to go up and up and up, so they're now the most expensive state. And then finally, last week I read a report that TennCare is a program down in Tennessee, and people said that's been around for a while. Yeah, but let's look at the success of that. Their rates have tripled in 10 years, and TennCare now represents 1/3 of the state budget. Now, we can't even get a state budget here. Can you imagine if 1/3 of it was for health care and they had to try to put something together? But these are results, like I said, of where government has been involved with health care. Now, the TennCare article that was out last week, they did have a quote that I want to read. It says, TennCare is a cautionary, on the page, it didn't say turn the page in the photo. It's a cautionary tale for us all. TennCare's lesson is control costs, control costs, control costs. It further stated that many people dropped their private coverage to enroll in a less expensive government-subsidized program. So that was a common theme throughout as well. People were dropping their coverage that they had on their own to enroll in the government programs that were subsidized because they were cheaper, but as a result of it, the cost for those government plans continued to escalate. And then people couldn't get back into their other plans. So again, I guess I have a message to Washington. If what you're going to do doesn't tackle the true costs of health care, don't do it. It's just a temporary Band-Aid. It's a mask, and we're going to end up paying for it much more deeply out of our pockets later on. So we have to slow them down. We have to stop them in this process and make them understand that we're serious. They continue to blame insurance companies. They're not doing anything about the escalating costs. And I tell people that when you think about it, you can't blame the insurance company. Hospitals and doctors and labs don't charge what they do because of what premiums are. Premiums are based upon what the medical charges are. It's the cost of health care that keeps going up. And that continues in all the other countries as well. They're all facing the same thing, the cost of their health care. That's why they're rationing care even more. When you have new drugs that are $40,000 and $50,000 a month, and we do have drugs that cost that much now. I don't care if it's a government plan or a private plan, somebody's got to pay for it. Okay, we have new technologies and everything. So we have to find a way to control the cost of health care, or you're not going to be able to slow it down. The other area, when I was down there in March and April in healthcare meetings, we asked some of the senators and congressmen that we met with, we said, where are you at with tort reform? It's a big issue. We have to have tort reform. And they all told us it's not even on the table. We're not even interested in discussing it. And I have my own philosophy on that. I said, well, part of it is I think that because most of them that are down there are attorneys by trade, and they don't want to give that up in case they lose their seat and have to go back into practicing. Why do they want to give up that tort reform? Many of them, like John Edwards, that's where he made his money. Okay? But it's something that we have to work on because half the tests that are done, they say, aren't medically necessary. It's a big part of the cost that's out there. And we have to find a way, and they admitted it, Howard Dean last week. How many of you, or 2 weeks ago, how many of you heard what he said as to why they're not? What did he say? What was the reason for not taking on tort reform?
There's a main member of the Democratic Party.
And he didn't want to take on the trial lawyers. Exactly. And I'm sorry, I think that it's time that they have to take on the trial lawyers. So, or we're not going to get this resolved. I also want to talk a couple minutes here about government efficiency, because the government keeps saying how much better they can take care of health care than the private insurance carriers can. Well, here's some interesting information. Last year I had the privilege of sitting in on a committee meeting, and Senator Bob Bennett was in the